Hi and welcome. We are Group 2 and the name of our intervention is #CheckMeLGBT. So our aim, goals, and objectives are: the aim of our project is to increase the HIV testing rates among LGBT students at SDSU. Our goals are to develop effective and comprehensive education material aimed specifically towards SDSU's LGBT population. We also want to raise awareness about the dangers of HIV, to increase testing rates, and to promote healthy sexual behavior to minimize HIV infections in the target population. Our objectives are to analyze and investigate a potential correlation between health education and the likelihood of getting tested for HIV. We also want to compare knowledge and attitudes toward testing with the students' actions in regards to HIV testing, and we also want to determine if there is an increase in HIV testing among SDSU students who attended #CheckMeLGBT health education events. Factors that influence our outcomes are logistics, because we want everything to be done in a timely fashion, the number of attendees that come to our intervention. We do want to be able to have a nice sample size, bias and honesty among our surveys, and also human error in collecting data and anything that goes wrong with the logistics. So the rationale behind our project is that there are currently 34 million people are currently living with HIV and AIDS. HIV is not only fatal but easily transmitted. The LGBT community is at especially high risk for contracting HIV. Spreads of HIV and AIDS can be easily prevented through education and regular testing. There are currently a shortage of adequate programs within the LGBT community that seek to raise awareness about the importance about HIV testing.
Our sampling frame are those who are attending the SDSU Pride Week and are interested in getting tested for HIV at the event. Those who agreed to getting tested for HIV at Pride Week and agree to take a pre- and post-test survey regardless of their HIV swab test results are those who we will measure. We will be using quantitative data subjectively through a survey. We will provide questions with ordinal and ratio measurements. For example, agree or disagree, and a brief demographic in relation to HIV awareness. The pre-test will be taken before HIV testing, and our post-test will be taken weeks after their test to see if HIV testing has made a significant influence on HIV awareness. Post-test will be emailed with a link via SurveyMonkey.
We will be using primary data for our intervention, which gives us the advantage of knowing basic information specific to our program needs and discluding biases that may arise by using other data sets. This information will come directly from our target population of LGBT college students between the ages of 18 through 24. Our program will be a peer-led intervention, which has been proven to be the most effective of health interventions among college students. We will be conducting questionnaires as well as face-to-face interviews, which would allow us to get in-depth responses on popular views of HIV and HIV testing.